Good afternoon, Dr. IZYAN. My name is KESAVA VIKNESWARAN, and I'll be representing my group to to presentate about the project 2 that we have done, which is in the title of Statistical Analysis of Mental Health Impact of COVID-19 and Vaccination on UTM Students. This is the group members of our team: KESAVA, MAHATHEVAN, KUGAANN, SURESH, and VAJHRA. The contents of the slide is as following as below: introduction, dataset and description, statistical method used, summary of results, and conclusion. So the introduction would basically be the COVID-19. As all you know, COVID-19 has disrupted a lot of academic routines in our UTM and emotionally and psychologically. So as a team, what we wanted to discover was to explore the mental health landscape during and after the pandemic, particularly how students coped and whether public health measures like vaccination made a meaningful difference or not in the daily lives of them. The dataset and description for this project, we conducted a survey and we gathered 61 sample sizes of UTM students participated in it. The population is all undergraduate UTM students, and we have a number of 11 variables in this, as the following in below. So the next would be the key variables collected, uh, shown over here, and each variable is categorized in its own level of measurement, nominal and ordinal ratio, and we managed to have all of them, so we have all kind of analysis. So the statistical method that we used was two sample hypothesis test, used to compare the CGPA between male and female students, and then the correlation test used to assess the relationship between sleep duration and mental health. The regression test used to evaluate if COVID-19 infect frequency predicts mental health rating. And the fourth one and the last one should be the T-square test of independence, which used to determine if stress before and after vaccine are related or not. So for the first one, this test was mainly done by with 95 confidence interval level. And what we tested was the gender, if the gender of male female affects the UTM COVID-19. So the null hypothesis would be no difference in CGPA between genders, and the alternate should be there is a difference. And the result that we got was uh, we fail to reject the HO, which means the conclusion is that there's no statistically difference in CGPA between male and female students. Gender does not appear the influence of CGPA. It does not play a role. And for the correlation test, this analysis explores the relationship between the sleep duration and the self-reported mental health during the COVID-19. We use Pearson correlation test to determine if a linear relationship exists. What we tested was the hours of sleep and mental health rating. The null hypothesis would be no linear correlations, and the alternate there is a correlation. So the result was the correlation coefficient was 0.256 and the test statistics is 2.032 t-test, and then we did a degree of freedom, which is n minus 2. We got this one, and the p-value and the decision of p-value, we reject the HO, which means there is a weak but statistically significant positive correlation between sleep and duration mental health. Students who sleep more tend to report slightly better mental well-being. As for the third one, regression test, time infected versus mental health. This we tested what is the independence variable. The independence variable X is time tested positive for COVID-19. How many times they have frequently tested as positive. The dependent variable would be mental health rating, and the regression model is Y3.9318 and 0. Minus 0.2601x. So the key result that we did was we had an intercept. The slope was negative 0.2601. The coefficient of determination R square is 0.0089. Only 0.89% of variation explained. The standard error is shown as before. The test statistics, degree of critical freedom, and the decision, we reject the HO. So the conclusion that we took from this regression test was that the number of times of student was infected has a statistically significant but very small negative effect on mental health. Each additional infection slightly reduces the predicted mental health score. And as for the last one, which was the optional one, we choose the chi-square test of independence. We took this 5% of significance level, and what we tested was the stress level before vaccination and stress level after vaccination. We want to see how it affected. So the hypothesis was the null hypothesis was stress level before and after vaccination are independent, and alternate was it's dependent. So the key results was we found out the degree of freedom was 12. The critical value is 0.05 and 12, which is we got from the sample. We got from the significance level and everything. Then we got 26.2962, and the test statistics was 72.55. Since it's like higher, we reject the HO. So the conclusion was there is a statistically significant relationship between students' stress levels before and after vaccination. So students who were stressed before vaccination often remain stressed afterward. So the summary of results of all of this was like we analyzed that the data set of 61 UTM students will identify several meaningful relationships, which are the following below. There's no significant difference in CGPA between male and female from the sample test of hypothesis to sample test, and the weak but statistically significant position correlation exists between sleep duration and mental health rating from the correlation test. Students who tested positive for COVID-19 more frequently tend to have slightly lower mental health scores, though the effect is very small, which is from the regression test. And the last one should be stress levels before and after vaccination are related, indicating the pre-existing stress often continues to the post-vaccination. This is from the before one, which is the chi-square test of independence. The conclusion that we made was this project gave us many insights of what happened to UTM students throughout the pandemic, before and after. And what we took as a key takeaway was gender should not did not play a role in this, and then it's really good to report a better mental health if uh, we have a good health sleeping habits. And then the third one is like students who tested COVID-19 more frequently tend to have slightly lower mental health, and then there is a significant relationship from after and before they are related, the stress levels. So these are the findings that we did. Overall, this analysis helped us to understand and interconnect how human psychology works in a COVID-19 pandemic before and after, and how it affects the academic performance during a crisis. And it also enhanced our skills in data interpretation, hypothesis testing, and the use of statistical look like R Studio. So thank you very much. That's all from me.